So now we're going to talk about my favorite thing. What's the only thing that price is actually going down in the United States of America instead of up? Vaginal estrogen. It is getting cheaper and cheaper and cheaper, and I just love seeing it. It's so great. This stuff has been around for decades. 78-year-old female comes with urine. She's a bread and butter, overactive bladder person. She's failed her first-line therapies, gets a couple of UTIs, and maybe we stopped having sex. Does she have 3 problems, or does she have 1 problem? She has genitourinary syndrome of menopause, which is a constellation of symptoms because of low hormones. Who got taught what menopause was in medical school? Yeah, no shit, right? Did you know that women are 50% of the population? That is so crazy. And if doctors didn't get taught a lot about menopause, which is a normal occurrence in 50% of the population, but what's normal can cause pathology and disease. Patients really don't know what's happening with menopause. Patients think menopause is something that happened back then when my period stopped and I had some hot flashes. They have no idea that this is like taking your testicles and removing them. This is taking your testicles and removing them. What happens? We give those guys Lupron. What happens to them? Lots of things happen to them. And this is what happens in your pelvis when you take your hormone-secreting ovaries and you outlive them, which is a whole separate, massively interesting topic. We used to call this the senile vagina. I found this out because I had my hospital librarian pull up a paper from 1985 because I wanted to debunk the use it or lose it claim that floats around the internet like every Tuesday. And they said, senile vagina. And I'm like, well, vulvovaginal atrophy is not that bad of a term if it came from senile vagina. But they didn't like vulvovaginal atrophy either, and it didn't explain the bladder issues. So we renamed it to GSM because it includes the pelvis, amazing amount of estrogen receptors in the trigone of the bladder. This is a chronic progressive disorder. This is why women come in and you say, this is because of menopause. And they're like, doctor, menopause was 12 years ago. You're like, no, you still don't have any hormones, and things get worse. Beautiful, resilient, great pH, and then it all goes away. Estrogen receptors are in our inner ear, they're in our retina, they're in our brain, they're in our muscle. Estrogen receptors are everywhere. It doesn't just make you get pregnant. So you know the changes in anatomy, but look at this. This is all urology problems. Oh my God. All of this. So healthy, look at that protected urethra. That protected urethra doesn't get urinary tract infections. Look how healthy it is. Look how lubricated it is. Telescoping urethra becomes pronounced. Once you know what this is, you will see this on exam all the time. She can't have penetrative intercourse. That ended years ago. It's tight, easily friable because the vestibule loses all of its hormones. What a woman tells you and how a woman looks. That's GSM. You don't need a fancy test. A woman can have symptoms, and how many times does she get told she has a normal exam down there? Because a lot of gynecologists just think that the vestibule is the gateway to the cervix. But I have seen people where it still looks pretty darn healthy, but they still have symptoms. Treat them. They will get better a lot of the time. A woman came to visit me. She was from Georgia or Louisiana. I live in Washington State. So she flew all the way up and she said, doctor, I'm on 3 antibiotics, one of which is gentamicin. And the urologist said, I'm going to be on these antibiotics for at least 3 years. He's an expert in embedded UTIs. I'm like, okay, well, what's your story? She's like, recurrent UTIs. I'm like, and her husband was there. I was like, are you guys intimate? No, we stopped being intimate two years ago. Okay. Do you have any pain? Yeah, I've got tailbone pain right here. Oh, okay. What else is going on? Listen to her story. She had genitourinary syndrome of menopause. The urologist who was the embedded UTI expert never did a physical exam, never asked her about her bladder, never asked her about her sex life or her associated pelvic floor dysfunction from all of the pain that she was having. I got her in to see a physical therapist that day. I gave her a very cheap tube of vaginal estrogen, and she looks at me and she's like, is it possible I don't need to be on these antibiotics for the next couple of years? And I'm like, it's incredibly possible that you don't need to be on these antibiotics. You cannot prevent atrophy by not having kids. You can't prevent atrophy by being a certain body weight. All of these myths on the use it or lose it myth. Friction in the vagina does not prevent a hormone issue. So urologists are the first line. We know the pelvis. We know pelvises more than anybody else. We know hormones more than anybody else. We can talk about sex more than anybody else. And first line treatments are very cheap. Anticholinergics equal vaginal estrogen. This is published literature, but it's in the Menopause journal. And how many urologists are reading the Menopause journal? I am now, because I'm very weird. But I'm like, holy shit, did you learn that in your AUA guidelines? So you got something that's contraindicated in 65-year-olds versus something that everybody should be on when they're 65, and they have equal efficacy. This is tolterodine with vaginal estrogen cream. The tolterodine vaginal estrogen cream actually did better than any of them alone. Nocturia is so hard to treat. Vaginal estrogen helps. Compared to placebo, vaginal estrogen improves all of the things you see urologists for. I'm not going to go into UTIs because we've got the amazing Suzette Sutherland for that. We have amazing non-hormonals. I love them because sometimes you need more than a hormone. They just feel comfortable. They need something more. I think you can go up higher than the standard dose of vaginal estrogen, by the way, but non-hormonals are lovely. They're lovely options. And there's other things besides vaginal estrogen, but vaginal estrogen is the cheapest. The thing I've been underusing is ospemifene, which is oral. It's actually a SERM. It's bone protective, it's breast protective, but there's a side effect of hot flashes in some people, just the way that it works. But for your little old ladies who can't, or your little big ladies who can't get vaginal estrogen products up, it's an oral option. There is not study data specifically on recurrent UTIs for this medication, but they did note decreased UTIs in the population. It just wasn't a recurrent UTI study. So I think it's the therapeutic standard. For this is a hormone problem, therefore a hormone fixes it. Incredibly safe. There's hardly a person who can't be on vaginal estrogen. This is local therapy. It does not go in your body. We've got guidelines online for your patients to find. Very, very safe. I don't like the loading dose because especially if you're atrophic, you're sucking in a lot of product, and they'll call your office and they'll be like, my blood pressure's up and my breasts are tender. I don't do loading doses. There's no data to say why you ever need to do a loading dose, so I just don't do it. Plus, I think it's confusing for people. If you don't tell women that the FDA warning label is wrong, they will read it and stop. Probable dementia? Are you kidding me? For something that doesn't even get into your body? So we're currently working on a campaign called Unboxing Estrogen. And we are proposing to the FDA to remove the box label from vaginal estrogen products because it is, first of all, a lie. Second of all, it prevents people from getting care. It won't work if you don't use it or if they read the label. I like the cream. This is a sex med study. If you put it on the vestibule, it helps pain with penetration. So that's why I like the cream. Put it on the clitoris, put it on the labia. $13, Mark Cuban cost plus drugs plus $7 shipping. I just got mine there. The price keeps dropping. It's very, very cool. They've done 2 studies in men. If I put my vaginal estrogen cream in and then I have penetrative intercourse with a man, will his estrogen levels go up? Yes, a little bit, but men have estrogen too, and it's not above what normal is for men. They drew their blood, I think, 12 hours afterwards. I think it's preventative medicine like flossing and wearing seatbelts. What do I say? Age 55? If this is a disorder that 50 to 80% of people get, why wait till you suffer to come in? Why wouldn't you just want to prevent this problem? And it treats so many urology complaints in one. You don't know what to do? You dry? You burning? Get some estrogen cream. My scribe made me that. There you go.